my name is Ateke, and I'll be talking to you about off-label psychiatric medication in pediatric population. Off-label medications shouldn't be prescribed to pediatrics and children. Off-label medication are usually overutilized and not approved by the Food and Drug Administration. There are many problems with prescribing off-label medication in pediatrics. The problems is that these type of medications are considered to be off-label is dispensed outside of the age limit. It also lacks pediatric information. The lack of pediatric clinic trials or the medication is not recommended for the use of children. 20 to 30% of this medication prescribed to children are not FDA approved. There are many problems with prescribing the off-label medication in pediatrics. Most of these medications lack sufficient research and they do not show efficient and safety for the use of the psychotic medication on children. Also, there is just not enough research showing the effects of off-label psychiatric medication in the use in children and the development of their brain. Another problem in prescribing off-label medication to children is that many of these medications are only tested on adults. This is a problem because children absorb medication differently than adults, so their reaction to the drug may cause serious problems. So therefore, this product that has not been studied in children is possibly for an adverse effect to occur that may not be listed on the drug label. In many cases, I feel that doctors are not waiting long enough to diagnose children with mental health issues. This leads to them getting the off-label medication way too early, which most of the time is not even FDA approved. Most of these drugs are used today to treat mental health conditions and have been available for a relatively short time. Therefore, we do not know as much as we ought to know about long safety profiles for young people. I believe that some children will grow out of some disorders with the time and maturity. The problem with the country is that many parents and health professionals are so quick to prescribe drugs for any abnormality, thus making individuals dependent on this medication. The United States has an enormous amount of children being diagnosed with mental health issues compared to other countries. In a recent survey, the National Survey of Children's Health, 5.4 million children in the United States reported to have ADHD and ADD, with an embarrassment towards our state. New Jersey has one of the highest numbers of children reported with this diagnosis and this disorder. Off-label medications have many effects on the children that many parents may not be aware of. For younger kids who are growing, it is really an issue with taking these medications. Most parents should worry about the downtime that occurs after the medication subsides. When a child's medication wears off, it can leave them very cranky. This is some of the individuals called the rebound effect. Some children more anxious, leaving the children more anxious than when they were when the medication wears off, not taking the medication at all. What is happening is that the medication is leaving the receptors in the brain too quickly. Off-label medications often make sleep a challenge. Lack of information with this drug used outcome may also put children at higher risk for medication errors, such as side effects and unwanted drug reactions. Children with ADHD often have problems falling asleep, which adds to the amount of prescription that child needs to take on a daily basis. A recent survey that was done by the Dutch Children's Hospital was done with 281 licensed drug prescriptions and 1,574 unlicensed for off-label drug prescriptions. While studies show although unlicensed and off-label prescription drugs do not necessarily carry an actual threat of the health of the child, the risk of adverse reactions is very high. While there are so many negatives aimed at the off-label medication in children, there are many benefits of off-label use of medication. Although there is an FDA approved and many medications used in children, there are still some benefits. Off-label use of medication may be needed to avoid unwanted risks to children, and such as physical harm to themselves or family disruption. A review on a long-term study of the off-label medication and substance abuse was conducted by the researcher of Massachusetts of Harvard Medical School. They found that teenagers with ADHD who remained on these medications during their teen years had a lower likelihood of substance use or abuse than did adolescents who not taken the medication. For children with ADHD who do not respond to the approved ADHD medication or who cannot tolerate the side effects. Other medications may be helpful. Sometimes the healthcare providers may prescribe an ADHD medication for a young child or an adult, even though the drug is not approved for adults or younger children, which is off-label medication. While it may be some benefits in taking off-label medication in children, the bad outweighs the good. In my opinion, it just has not been enough research for the adverse reaction while these medications are taken by children. I feel that these off-label medications should be illegal to give to the children. There are too many risks when the medications are prescribed. It has many effects on children, and doctors are relying on these medications way too often in children. Off-label medications should just not be prescribed for children.